Hello world, my name is Dr. Kundlas and I'm a primary care physician. Let us discuss about pulsatile tinnitus. Tinnitus is one of the most difficult and disabling disease. You have screwed up pathophysiology in your auditory system where there is no stimulus, but your body is creating these phantom sounds which are so disabling. And tinnitus could happen due to multiple reasons, starting from external ear, in middle ear, inner ear, eustachian tube, your throat, your neck muscles, and your blood vessels and TMJ. But pulsatile tinnitus is something which we should give it a proper credence and we should understand. We all have a feeling when we can feel the flow of blood through our blood vessels, especially we feel it when we go to bed and sometime when we touch the pillow and we could hear that pulse going into through an ear. But that pulsatile persistent tinnitus or a sound is very important. It is very rhythmic. It matches with heartbeat. So you can put a hand over here and you could feel every time your heart is beating and you are hearing that sound. Why this thing is important? As I said, normally tinnitus is a phantom sound, but pulsatile tinnitus is not. In pulsatile tinnitus, you have a problem in the vascular system. Either you have blockages in your blood vessels due to atherosclerosis, or there is some other anatomical changes which is creating turbulence. You may have a tumor in the blood vessels, you could have infection in your ears, and sometimes your blood pressure may be high. So once you have a pulsatile tinnitus, it is a pathological. If you hear thump of your heart and you're feeling in your ears being conducted either through pillow or without any pillow, that is pulsatile tinnitus, means there is some pathological problem with your vascular system. What you should do? Don't ignore it. Go and tell your physician, and they will most likely order a carotid ultrasound to check the flow, and they will rule out any kind of plaques or any kind of buildup in your carotid arteries. Further, they will also examine you, of course. They will check your blood pressure and they will rule out any kind of infections. Most of the time, beyond that carotid Doppler, you are not needing anything. If they find any of the blockages, you will be referred to vascular surgeon and you will be treated appropriately. But if you do find some blockages in your arteries, this means the process of hardening of arteries has already started. You should consider strongly modifying your risk factors. What are those risk factors? Management of high blood pressure, cholesterol, diabetes, and smoking. If you're a smoker, quit smoking. Make sure your blood pressure is treated to the target. Make sure you take cholesterol medication. As a physician, we find that is one of the medication which is prescribed the most, but the patients make their own choice of not taking it. Exercise, managing your stress, proper sleep, and diet, they all will lead to improvement of your vascular health and leading to cure of pulsatile tinnitus. If your physician do not find any blockages and your blood pressure and all those other assumptions are good, then routine therapies for tinnitus, including cognitive behavioral therapy, where you are diverting your attention on something other than that sound which is constantly going on in your body and brain. Also music therapy, alternative therapies like sometimes exercises, all those things are on the table and you should get proper treatment and should be properly treated. I want to ensure that we do not ignore pulsatile tinnitus. Pulsatile tinnitus could be a harbinger of significant vascular problems. Don't ignore it. Get yourself checked, and if you don't get proper answer, continue to insist to be tested and modify your risk factors. I hope this video was helpful. Please like, share and subscribe to our channel. My name is Dr. Kundlas, and I will see you in next video. Thank you very much.